Classified as a respiratory disease, COVID-19 is also taking aim at our body's blood vessels.
People have actually lost legs from small vessel clots in arteries for really advanced COVID-19 patients.
Dr. David Dexter is a vascular surgeon with Sentara Healthcare. He says since the pandemic started, they have seen a significant number of severe COVID patients develop blood clots.
Not only do we see increased clotting disorders, but we also see increased bleeding disorders as well, making this a much harder challenge for us clinically.
Knowing this, healthcare providers have changed their approach to treatment. So people who are sick enough to go to the hospital are proactively given blood thinners.
They're going to go to an appropriate level of care in the hospital and get the best COVID treatment that we can offer them.
While there are still a lot of unknowns about COVID-19, physicians say that they are uncovering new symptoms, which helps them better understand the virus. Like what Paul Merrick, the chief of pulmonary critical care at EVMS, calls the three fundamental problems to COVID,
which is hyperinflammation, decreased oxygen, and this increased clotting.
For severe patients in the hospital, these things can be monitored, but
the more difficult question is, what do you do about patients who are mildly symptomatic at home? Because they too have an increased risk of clotting.
Especially when symptoms can stick around for weeks. Merrick suggests taking aspirin, getting daily movement, and keeping an eye out for potential clots.
This is a serious disease. We can't minimize how dangerous this disease is.
I think it's about information sharing, talking about patients early, making sure people are getting the best of what they can get.
In Norfolk, Erin Miller, News 3.